medical education, and to this our series on meeting our partners. My name's Dr. Minnie LeCamp. I'm one of the medical directors and founders at Horizon. Over the past few years, we've been incredibly fortunate to form some amazing partnerships. And today, my guest is a medical doctor, registrar, and medical superintendent in charge of Macburaka Government Hospital in Tonkalili, Northern Sierra Leone, Dr. Yusuf Tejan. Hello, Yusuf, and thank you so much for joining me.
Hello, Minnie. It's my pleasure to join you today on this call.
Thank you.
Welcome.
So we first met, Yusuf, didn't we, back in May of 2022, when you contacted us at Horizon to provide some educational courses for your clinicians in the hospital that you work in.
Yes. So by that time, I had just been asked to manage a district hospital in one of the most remote settings in Sierra Leone. So we had a lot of issues, challenges with human resource, the quality of care, and also the medical ethics, and a whole lot of cross-cutting issues that actually affect people accessing and utilizing services in the remote setting. Mm. So on my assessment, I thought that the community health officers, the CHOs, who makes about 80% of the gatekeepers, that is the first responders in the health system in Sierra Leone, that they needed some support, they needed help, they needed some knowledge and key competencies to provide a high quality care within my hospital and even in Sierra Leone. So I reached out I saw Horizon Medical Education CME online on TB and hypertension, and I went through, and I was totally impressed that, I mean, this could be one of the few areas that which we could explore as a health facility. So I made my personal contact to Nicola, who made a post on Facebook, and I asked whether he could assist my hospital, my CHOs, and my other clinicians to have access to this platform.
Yeah.
So I pitched out the idea, the quality of care in Sierra Leone, and how the community health officers who are in dire need of this knowledge who use this one to make impact in the facilities or in my hospital. So that is how I met.
How you met us.
Yes, I met you all.
Yeah.
And it has been interesting, and the results have been fantastic.
Yeah. So first of all, Yusuf, I'd like to just talk a bit about you, actually. Is that okay?
Yeah.
I mean, you're such an inspiration, and you're an amazing advocate for healthcare in Sierra Leone. All the things you've done. I'd love to know, and people that will listen to this will love to know a little bit more about you and how you became a doctor. And was healthcare always an ambition of yours?
Innately, I'll say healthcare had been an ambition for me. Mind you, when at the end of the Civil War in 2002 in Sierra Leone, I was 12 years old when I was taken to assist my elder sister in doing petty trading in Bo, the southern Sierra Leone. Mm-hmm. So I started my schooling that year, and in high school, I got a fantastic result, and I was able to get scholarship to enroll into medical school. Mm. So medical school was a calling for me, because by the time I completed my high school, I didn't have a scholarship to enroll into any tertiary institution in Sierra Leone because of my financial background. Uh-huh. My parents, we are all farmers, and my sister was just a petty trader. She was just making a subsistence business, just to live and survive in at the end of the Civil War. Mm-hmm. So it was really, really difficult to have support. But we have an organization they call the Helping Children Worldwide, which is a US charity organization that actually sponsored me throughout medical school. After a proposal was sent to them about my result, because I got the best result in the sub-region in 2008. So I didn't have any sponsorship. So they accepted the proposal to support me through medical school. But despite entering medical school, I learned that I never had in mind that after high school I would enter medical school. I was just a kid who was trying to build himself, being the first generation to achieve secondary education or even tertiary education in your family. It's something that is really amazing. But no one actually cares in your family because they are not from, they do not have education, they don't know the value of education. So it was extremely difficult for me. So the sponsorship I got was inadequate because I was not able to get my medical materials. I was not able to get adequate transportation and even lunch, even accommodation. So it was really, really difficult. And I was the only one in Freetown by then. All my parents were in the villages.
So
and my
the
sister
medical school was in Freetown in Sierra Leone, was it?
Yes, the one and only medical school we have right now is in Freetown, Sierra Leone. So anyone that wants to become a medical doctor has to go to Freetown to do the program. So it was challenging. At some point in the medical school, I wanted to drop off. I wanted to leave medical school because it was so agonizing. It was so tough, and I had so many reflections. You know, myself, my family, and my struggle throughout the 11-year civil war. And I went to medical school again. You know, to even survive was really tough. But I got personal inspiration from people who believed in me, people who I've been in contact with all the time, and some of my sponsors. So in 2014, when we had the Ebola outbreak, and I went to volunteer as one of the disease surveillance officers.
That must have been quite frightening.
Yeah, it was frightening. But you know, sometimes when you have these issues, you as a person, as an individual, you take it as an opportunity to survive. So while other people were running away from Ebola, some of us we are moving forward to the front line because I needed the support. Because by then I had to write my thesis, I had to do my research, I had to do my electives in the rural areas, and I didn't have any sponsorship. So I used that one, and since they were giving like $80 per month to all disease surveillance officers. So I work with MSF Switzerland in Freetown. I work in community with WHO, CDC, and some other staff. I work with one consultant, Dr. Alexandra Calmi in Australia. She's still a friend of mine. We used to communicate on social media. But that was how I survived through medical school. And in 2015, I graduated as a medical doctor. I did my intern. But hence since, when I take any role, when I work anywhere, I take a deep reflection on my life as a survivor of the Civil War, as someone who had no support throughout high school, someone who barely entered a tertiary institution to do a medical program.
Yeah, amazing.
A medical program. And I say it was just a calling because I never knew I would become a medical doctor. So I've always reflected on this, and I have let this serve as a self-inspiration and to also help more people, not only to achieve what their dreams, but to also provide a high quality of service wherever they are, in all positions they are. So that is just me.
I mean, it's amazing to become a doctor. It's so hard. Living was so hard, let alone doing the medical, you know, all the academic work, which is immense, isn't it? I mean, there's a lot to learn.
A lot.
So you're very active with initiatives within healthcare within Sierra Leone, aren't you? And can you explain to us a little bit about the structure of healthcare in Sierra Leone? Because in, you know, for example, in the UK, we don't have the same cadre of professionals as the community health officers. And you said, you know, they provide about 80% of the primary care in Sierra Leone. They're the gatekeepers, the first port of call. Would that be right?
Yes. Thank you very much. So the Sierra Leone health system, just like other low and income countries, is really challenged with a lot of issues. So one of the key issues had been human resource for health. So we have this cadre of community health officers. They are like physician assistants, actually. So they do a 3 to 4 years program in a university, one of the oldest universities in Sierra Leone, the Jala University. And the community health program is one of the oldest health institutions in Sierra Leone. Okay, they started way back, you know, in the southern Sierra Leone, and they've been producing a huge lot of community health workers. So the challenge in the Sierra Leone health system is they are not often able to absorb, to employ all of them. They are not often able to provide adequate training to all of them, even after graduations. But their program is very interesting. I've supervised and monitor most of them, in my facility and other places, I've worked with them. Their program is very rich, but after graduation, they actually do not have any opportunity to any other learning materials or other platforms. Okay.
And yet they're expected to see everybody and make decisions at the first port of call. So you need quite a breadth of knowledge for that, don't you?
Exactly. So now the issue I identify about the community health workers before I brought this initiative is that it is not the absence of opportunity. It is the lack of access to opportunities like online educations. But some of them, when you teach, because I started teaching some of them when I took over the hospital, but it was difficult for, only me to be doing that. And we have a whole lot of them across the country. We have over 10,000 community health officers who most of them are unemployed. And they had all primary health care units in the district, in the most remote areas. Mind you, we have the secondary health care is actually the hospitals. The doctors are only at the hospitals. And we have the tertiary hospital, which is mostly in the regional district and in Freetown. So, but the rest of the primary health care facility, which actually is accessible to over 70% of Sierra Leoneans, is managed by the community health officer, the physician assistant. Okay. So I think that building the capacity of these, huge number of healthcare workers who add quality to the health system and even support the universal health coverage, which the Ministry of Health and Sanitation is promoting currently. Okay. And the maternal death, the under 5 death, and some other key health indicators in Sierra Leone is being driven from the primary health care, with respect to what? Early identification, early referral, okay, and ethical, behavior of healthcare workers, in respect to what? Attending to pregnant women and even people with non-communicable conditions, okay? So this is the kind of healthcare system we have in Sierra Leone.
And you talked about them not receiving sort of more education or training once they qualified, but you very much trying to change that. You've done some training yourself. Now, obviously, e-learning that we produce at Horizon, there are certain things that you need to be able to access it. You need to be able to access the internet. You need to have something to access it on, like a laptop or smartphone, and you need data. But how do you feel that the e-learning was received amongst the community health officers? Do you think they found it useful? Do you think they found it easy?
Yeah, well, we had our strength in Sierra Leone of recent that most people now have smartphones. Okay, a huge number, more than 80% of people have smartphones. Then the internet access, the internet access has improved dramatically over the past 4 to 5 years. Okay, so we have more mobile companies who provide internet access in many other places. Okay, the cost to access internet, is still there, but these people are put in position actually to be able to have some amount of funds to help them to access these internet services. So it has been challenging for some in remote setting where maybe we have some areas that are in hard to reach areas. So hard to reach areas, and it's actually very difficult to even reach alone on foot or maybe to access internet services. But the other positive aspect of this online education was that the creation of awareness among all healthcare workers, among 80% of people who serve the most deprived population, about the availability, and accessibility of what online platform is actually very huge. Okay. When we roll out this whole program, it was very small. It was just a pilot at my hospital. But at the end of the day, when I attend national meetings, conferences, I meet with CHOs and other people who see my name on this platform, and I receive a very positive feedback. I receive the satisfaction, the anxiousness they have, and the appreciation they have with this platform available now at their disposal. Some of them never knew that they could get a certificate or they could get an in-depth knowledge about conditions like hypertension, diabetes, just online. And the different other, find details about how to manage patients who present at your facility with certain conditions.
Yeah.
They never knew. They only thought that they could only learn this through medical school or through go to get a very big book from somewhere else and sit down and read, not knowing that you can read you can do some of these programs real time and apply them directly in your facility to your service users.
Yeah.
So the overall outcome was really fantastic.
Yeah. I mean, one good thing about it is that you can roll out a standardized information, so everybody receives the same level and the same quality of information. I mean, obviously everyone learns in a different way, but it's fantastic that it's a new way, you know, like you say, it sort of opened people's eyes to a new way of learning. Do you think that the technology will help bridge the gap, that sort of the lack of education or training, continuous training?
Yes, technology will help a lot. In fact, I will say Sierra Leone is behind with technology, application of technology in education. With the emergence of COVID-19, we are able to know that you can do a whole master's program online. You can have Zoom meetings. You can have a lot of things online. So now, initially, people will participate in learning programs, face-to-face only. Okay.
Yeah.
And they have to be there. They have to be there. So except other disciplines wherein that you need a practical experience. Well, now most of the discipline could be divided into two. You have the bachelor experience and the knowledge and other competencies. Then you have the experience and the exposure, which has to be face to face. I think this is a platform. Even our medical school, our universities, other universities are now using this virtual platform to start, teaching, lecturing students, and then later on for the practical skills, they will have to go face to face. So this one will save time, this one will save money, and this one will increase the number of output and also the quality. And it will also introduce people to technology. So I believe this technology is the next. Now we're having what we call online consultations, audio visual and video consultations, and you are able to see, signs or classical issues on patients, and you're able to consult and advise patients on this. So I think technology is the next way out for Sierra Leone.
Yeah, and I do think it's not, you can't have it in isolation. I think it's definitely part of the sort of blend of education. Like you say, you can't get all your experience, but you can get an awful lot from the online learning, and keeping your skills, certainly your knowledge, up to date. It's a really useful tool.
Yeah, it is really.
Yeah. So just a little bit about the courses that we did with you from Horizon. You've had a look at the outcomes. What do you feel about that? Was the information helpful?
Yeah, thank you very much. The courses we did a whole lot of courses, from communicable and non-communicable diseases, infectious diseases. Most of the students, in fact, most of the teachers who we are participating in these courses, we are sending to me their certificate of completion, and they were giving their feedback in social media platforms, and they were expressing, how the course had improved, their way of practice and the quality they are providing right now in their respective settings. So when I saw the outcome, the course report, I was not surprised. Definitely, I was not surprised. The improvement, the improvements, and most of those comments, the feedback they were giving to me because these are my colleagues. We meet almost every day, and we meet in conferences, and they tell me how this course have helped them. I believe the courses we are very, very relevant, instrumental, and needed. In Sierra Leone.
Yeah. Well, we do look forward to carrying on putting more courses on for you and working with you. And, there is the opportunity for us to, if you have time or whether your colleagues want to help produce some of the courses for Sierra Leone, if that's something going forward, you or your colleagues would like to contribute to the content and to make sure that it stays relevant for Sierra Leoneans. that would be an amazing thing for us to be able to do.
Yeah, I'm sure we will give our support and also our feedback, and we'll always engage and see that we keep on improving. So now that the cause is, almost a lot of CHOs across the country, we even have other cadres. Doctors have shown interest. I have some colleague doctors in the police department. Yeah, so one of them called me, and he had read the Horizon Medical Education programs and the courses, and he has had feedback from his CHOs, okay, in the police hospital, and he was saying that he wants to join and maybe, roll out this course to more other staff in his facility, and he has seen the impact the course has created. These are some of the areas for recommendation, because we have other cadres like the nurses, the doctors, even us doctors, okay, who work in remote settings, who have interest in specific causes as well. So especially the nurses, I will talk more about the nurses. The nurses, they really need a lot of support, especially midwives. We know Sierra Leone has one of the worst maternal and child health indicators, and we are working very hard through the ministry and other partners to reduce these indicators. Okay, we can only reduce these indicators through individual commitment wherever we are, whatever we are doing, and I believe Horizon Medical Education or online courses is one of the few areas we can improve on ourselves so that we can provide the quality of care our patients deserve in all settings. So we'll give our recommendations, definitely.
Before we wrap up, because I realize that we've been talking for some time and I know you're busy, but you're very active at gaining support in all ways for your healthcare and your patients, aren't you? And I've noticed, when you were talking to Nicola and you were talking about your hospital feeding project, and we introduced you to someone we know who founded Face Donate to raise some money for feeding your inpatients because you were having a problem keeping people in hospital. Is that right?
Yes. Yes. The hospital feeding project is one of the highlights that our hospital has been commended for greatly, and it has actually motivated positively our partners to chip in to continue providing food in our hospital. When I took over, there are a lot of issues I identify. Often, as I say, we as healthcare workers, we have to use our positions as an opportunity to create impact. So we know that there are many challenges in the health system, but we have to be positive, in addressing these challenges. We have to ask ourselves specific questions. What could we do to create an impact? What could we do to feed more patients? What could we do to provide more, quality healthcare in our hospital? How could we help the government to ensure that, their overall objective is achieved at the hospital level? Okay. How could we help our staff to be more capacitated to provide a quality healthcare? How could we help all sectors in there? So when I came,
big questions, aren't they?
Big questions, really. When I came at the hospital, there was no government support, and we had a lot of patients that were leaving the hospital because they had no food. It was a sad scene for me. It was a very, very sad moment for me when I saw one woman with a twin pregnant who delivered twins who were premature, and of course severely underweight, severely low birth weight. And the woman was crying. She said she wanted to go. Then I went to her. I said, why do you want to go home? Your babies are yet matured. If you go home, they are unlikely to survive. She turned around and watched into my face that yesterday she didn't have the food, and today she's not sure having the food. Her husband had not visited for the past 5 days. She's barely surviving with tears in her eyes. I didn't utter a word. I just walked away, provide my little support. But I came back, sat in my office, and asked myself, how could I help this woman? So first, I started by posting on Facebook and my WhatsApp. Some colleagues in Sierra Leone, some are medical doctors, some are entrepreneurs, some lawyers. They donated, they sent some money, and that was how I started feeding my hospital. Because by then we had some rice that was supplied by the government. So all we needed was the sauce. So like we need about like $50 to feed the hospital, to buy a sauce for a day. So I got like 6 to 7 colleagues who sent their money urgently, because I wrote the story, and some of them called me personally, and I told them the situation, and they started. So Nick also saw my post on Facebook, and she said, "Oh, Yusuf, you have a very good initiative. I'll introduce you to someone, Face Donate." That was when I met Face Donate. And Alberto had been very, very helpful. So Alberto created a platform for me. I wrote the stories, I sent the stories, and we've been having money subsequently.
Still continuing today.
Yeah, I still continue today. And even though the money is not adequate, but it's quite better. We are looking for more donors. Yeah, we are looking for more donors. Now we have our partners, MSO, who are also supporting some of these feeding projects in some other units. So now we are the only hospital who has started feeding their patients since April 2022 up to date. We've not stopped at any moment.
Amazing.
Because I keep on telling my partners that we have to do something. We can't wait for the government support. We know the government has a lot of priority areas, but this is where we are.
It is a priority, isn't it?
Yes, it is. Yeah, this is where we are. This is our priority. This is where we see people crying, people dying because they just don't have food. And we know the hunger issue in the world, not only in Sierra Leone. Because of COVID-19, a lot of people did not do farming in remote setting in Sierra Leone. A lot of people. So most of them had been doing subsistence farming, but because of the COVID-19, and there were a lot of anxiety about this COVID-19, a lot of restrictions. So there was a reduction in the movement of people and even farming activities. So this is just the impact of COVID-19.
Yeah, it's been massive, hasn't it?
And we are trying to just make a difference in our little way. Face Donate, my appreciation to Nick and Alberto from Face Donate, and I just don't know what to say sometimes when I speak with colleagues, when people ask me about Face Donate. But Face Donate actually changed my hospital, has actually changed my life. Actually told me that it is possible to achieve something. All you need to do is to act, ask for help.
It's being brave to act as well, often, or having the courage to act, I think.
Yeah, exactly.
So just very briefly, yours is a government hospital. So do patients have to pay anything when they come, or is it all funded by government? How does your healthcare system work in that way?
Okay, so we have the free healthcare system in Sierra Leone, policy in Sierra Leone. So the free healthcare policy covers pregnant women, lactating mothers, and under 5 children under 5. Okay, and other vulnerable groups like people with disability, people with HIV/AIDS, people in hard to reach areas, and people who cannot afford at all. So that is the healthcare system. The rest of the other categories of people, they will pay, even though the payment is highly subsidized. Said that. So we have the revenue generation component of the hospital. We have the free healthcare component in the hospital. For the pregnant women, lactating mothers, those in the category of free healthcare, no one pays anything. Admission, health, food, everything is free of cost. But in the other area, people have to pay at least to be able to buy reagents and continue running the facility.
Okay. Brilliant. And there was another initiative that I saw of yours, the mobile clinic. That's quite a new initiative, isn't it? I think. Is it always?
Yeah. No, it's an old initiative. It is run by the government, not me. But we do a lot of advocacy. Of course, we do a lot of advocacy for us to have the mobile outreach in our district, in our hospital. because the problem is the health system element now that is posing a lot of problem is the community-based approach, wherein people do not want to come to the health facility because of their prior experience encountering the health system.
Okay.
And also, some people live far away. Some people cannot afford even the minimal,
Yeah.
money to pay transport to the facility. So the mobile clinic has actually created a huge impact in Sierra Leone. They are going everywhere. It is supported by the government of Sierra Leone and some other partners. So we as the medical directors or medical superintendents just advocate and host and provide more justification to why they should come to our district and do this intervention.
Okay.
Yeah.
Brilliant. Well, that has been fantastic. You know, I could carry on talking to you all day, but I know you're busy.
Yeah, thank you for your time also.
And we really look forward to continuing to work with you in Sierra Leone, and I'd love to chat to you again soon.
All right, thank you very much. Thank you very much, Minnie. I'm glad to see you today.